Hi everyone, welcome to Not Only Diet Talk. This is the special episode. As you can see, we have someone very, very new to us as well that we just got to know. Our topic today is about probiotic for good mood. Okay, and our special episode today is sponsored by VITAGEN. Yeah, you see a lot of VITAGENs over here. So we want to focus on discussing how probiotics can actually improve our mood. So Shen, I just want to ask you lah. So what is your coping mechanism when you have a bad day?
For me, if I'm very, very stressed, right, I will just off from everything.
Okay.
Sometimes I relieve it from food.
Okay.
And sometimes I just engage for some exercise.
Oh, you engage exercise or you eat some food.
Yeah.
But do you know that actually by drinking cultured milk drink actually can help to improve our mood, like probiotics?
Oh,
Yeah.
so that it makes us feel happier?
Better maybe?
Okay.
Yeah. So
maybe something that we can find out.
exactly. So that's a glimpse of our conversation today
Yep.
with Professor Filza.
Yep.
We're gonna talk more, dig one by one about it, and then we're gonna talk about research papers as well that she came out with. Yeah. So basically, Shenyi, in the first episode, do you want to just have a recap about what is it about and stuff?
Yeah, so if some of you already watched or listened to our first special episode sponsored by VITAGEN, the speaker also did talk about how probiotic can improve the mood. And during the episode, I did mention we are going to talk more and further with someone who actually conducted the research that come up with result, and we are very glad that she's here with us today.
Yep, exactly. Yeah.
Right. So today, exactly, we are going to talk more about probiotic and how can it really improve our mood.
Exactly.
Yeah.
Other than that, maybe you can answer some of the questions that people have.
Yes.
Is it safe to drink probiotics? Because it's like a good bacteria, right? People usually classify it. So is it safe for us to drink bacteria? Yeah. So we leave all the questions to people right now for the beginning.
Yes.
Let us just introduce our speaker today. We have Professor Dr. Norfilza Mohd Mokhtar. She's a VITAGEN medical advisor.
Yep.
All right. So Professor Filza is actually currently a professor of Genome Medicine at the Faculty of Medicine, UKM. So it's a renowned university in Malaysia. Yeah. And she also currently leads the gut research group, which has recently been recognized as a research university group due to its groundbreaking contribution to digestive diseases. And she conducted numerous researches focusing on probiotics, specifically on what are the things that we're going to talk right now, and how probiotics can actually bring health benefits to various group of people. And other than that, as what we mentioned earlier, she is also currently the medical advisor for VITAGEN, providing expert guidance on the health benefits of probiotics in everyday nutrition.
Yep. Once again, welcome
Prof.
Thank
to
you.
Not Only Diet Talk.
Thank
Yeah.
you.
So so I think if we get the ball rolling right now, right, Prof, like how would you basically describe probiotics?
Right. Okay. First of all, thank you for both of you, Chong and Shinji, and Ameerul.
Yep.
It's really an honor for me to be with you, and you guys are very young. So I start with the definition of probiotic. Maybe people who are actually new in this, probiotic is actually, we have to go for the definition by the World Health Organization, which is they define it as a live microorganism, which is mostly it's in the form of bacteria and sometimes yeast. And you have to know that you have to take probiotic in adequate amount. If you take it in adequate amount, it will give you benefit for your health. That is actually the definition of probiotic. So what happened is that whether you realize or not, we actually, most of us, I think 3/4 of us is actually contain microorganism. Yeah, you have it in skin, you have it in everywhere, and of course intestine is, or digestive system is where it has the live microorganism as well. But what happened is that it has to be in balance, and this good bacteria has to be 85%, and we do have bad bacteria in us, 50%, and that has to be in balance. If they are in balance, then very good because it's very very important for our digestion, right? And also for our nutrient that we eat, whatever that we eat, this bacteria will take action on it, and of course our immune system. And that's where you will get a good gut health, because that is very important for your digestion, immune response, and also, eventually your mental health.
Understand. Wow, that's very brief information about it. But Shinji, before you go into the real question about it, so as we mentioned earlier, the main thing that we want to discuss today is the impact of probiotics to our good mood. So basically, how does actually the brain regulate our mood? Maybe we go into the physiology.
Yes.
Yeah.
How our brain. Yes.
So our mood is actually being controlled by central nervous system. We have central nervous system, brain, and spinal cord, but in this case, it's particularly brain. So brain, what happened is that they are the one who control our emotion. You feel sad, you feel calm, you feel stressed. Everything is controlled by our brain. So how is that they regulate it? So they have what is called as neurotransmitter. So by the name itself, neuro is from the neuron cells, and transmitter is actually the chemical. So the chemical agents that being released by that.
I see.
By our brain, basically.
By our brain.
Oh, okay.
Yes, yes.
So, what is the function of neurotransmitter, or maybe some of the example of neurotransmitter?
Right. Okay. If you realize that when you exercise, you feel good.
100%.
Yeah.
Always.
When you feel good, it's actually because of the good hormones being released, and that is actually endorphin. Yeah, that is actually being produced by the brain, and they are actually natural painkillers, and they are actually the one that mood boosters, and they are actually being released a lot during exercise. Another few things like in my study is serotonin. So we work and check the serotonin level. Serotonin is basically is produced by the brain, but very little percentage, but majority is being produced by our gut, our digestive system. So this serotonin is again what they call as a good happy hormones. They call it hormones, but actually it's not hormones, is neurotransmitter. So so some if you look into literature, it says that hormones, but it's actually neurotransmitter. So serotonin is actually is a happiness. If you're happy, serotonin will be released more. And we do have dopamine. It's again being released during your exercise. So that's why when you exercise, so this hormone, dopamine, endorphins, being released a lot, and you tend to exercise again.
Because you like the feeling of that.
And finally, is norepinephrine, which is actually the hormones that actually being released when you are in stress, or when you are being released, so that when you stress, it's cool you down. So that's how it manage. So there are multiple hormones, but we are actually really glad to have that, because you want to have like a positive feedback. The more you do, the better it would be.
And we want to have a good mood.
Exactly.
Of course,
Yes.
Okay, so before we move on further, just now, Prof. Filza, you mentioned about serotonin specifically. It is actually produced in our gut. But there are also certain neurotransmitter is produced by our brain.
Exactly.
So is that I heard about the terms of saying that our gut is actually like a second brain in our body. Like, is it true?
Yes, it is true.
Oh.
Yes.
Can you tell us more about it? Like,
good.
Our gut. We usually will never thought about there's actually a brain. There's actually like a brain here.
Yes. Okay. So everyone knows about brain, right? It has got like millions of neurons, and brain is actually the one that control majority of our function, body function, right? And we have a second brain which is in our gut, and they call that as a second brain because they also contain millions of neurons, and this system they call it as enteric, because that referring to the intestine, nervous because it's got neuron system, enteric nervous system. So this is actually located in our gut, and the good thing is that they can act independently.
Oh.
So like our brain, you don't have to ask the brain to work, and they can work by themselves. So what is the importance of enteric nervous system? It helps in the digestion. When you eat, so no one tell your intestine to digest, to absorb, no one. That is actually the role of enteric nervous system. And that is actually, you know, you want that enteric to act normally and efficiently, because your brain will get, you know, the effect will go to the brain. Yeah.
Okay, the good happy hormone.
Yes,
happy
yes,
serotonin.
yes.
I see. Okay, just now you mentioned so we basically mentioned two things like CNS,
Yes,
our brain,
yep.
and also ENS,
The
the
enteric,
second brain that we just get to know. Right, so does these two CNS and ENS work together?
Yes, it is. I think not many people knows that we have what is called as gut-brain axis.
Sorry, again?
Gut, because it's that's, and brain axis.
Okay.
So we have that, but not to say that there's something that connected, but basically they are actually connected bi-directional, which means that whatever that happen in the gut is actually can affect your brain. Or whatever that in the brain can actually due to the gut.
It's getting more interesting now.
Wow, okay.
You see, although they are actually located, you know, quite far,
Far
right?
from- yeah.
But actually, I mean, imagine if that day you have diarrhea or constipation.
It will affect.
How's your mood?
Very bad.
Very bad, right?
Like what I had today.
Yes. So if you have, you know, diarrhea in the morning, you don't feel like going to work.
That's true, makes sense, yeah.
It's mood, and this mood is actually because of this gut-brain axis. As simple as that. Or the other way around, if you feel that you are not in a good mood, it's probably because of your gut are not happy, because of the bacteria inside there are not in the balance for whatever reason.
Understand.
Yeah.
Okay. Right, Ameerul, before you move on next, right? I just when Prof Filza was mentioning about that, I just have a question before we move on to the next one. Sometimes when we are nervous, we will feel there is some butterfly inside our... We describe it as butterfly.
Or maybe when you see a girl, right, and then you want to flirt, and then you feel like a butterfly in your stomach.
Does that also because of our enteric, this ENS is working?
Yes.
Yes. All right.
Okay, so these two is actually connected, but because many studies have shown that it could be just a vagus nerve that's actually the nerve that connected between both, and it could just be because of the neurotransmitter. So neurotransmitter, as I said, serotonin is actually the one that is majority is being produced in our gut, and that is actually affects our brain. And that day you see that you are not that you nervous to go to the exam, all those interviews and all that. It's actually you actually affecting your gut as well.
Understand. Okay, that makes a lot of sense now in terms of scientific point of view.
At least we know right now what is working, what is happening.
Exactly.
Right?
Yes.
Okay, looking back into our topic today as well, right, about probiotics. So we understand how the system works, the neuron and stuff, the neurotransmitter. So how do probiotics actually help to improve our mood, if we can go deeper?
Okay, all right. So as I said just now, probiotic can actually helps in balancing our gut microbiota. So once you got a balanced bacteria, they will produce a good neurotransmitter like serotonin and all that. So that will actually help. That's one. And also with probiotic, that you have what is called as reduce the inflammation. Inflammation is actually a basic, basic process that if you have this inflammation all over your body, sometimes just a small micro inflammation, and that you don't want it to be, like for instance, if you fall and then you get wound and then you got redness. And that is inflammation, and that could happen in our body, right? So that is actually the role of probiotic, to reduce inflammation, because if you don't do anything to the inflammation, it will become chronic inflammation, and that will give rise to many diseases, and we don't want that. And of course, you all the stress hormone like cortisol,
Yep.
all those things are a stress hormone, and you want that stress hormone to be, not low level because of
Understand.
our, daily life.
Yep.
We are always faced with all the stresses
That's
around us.
true, yeah.
So that probiotic helps that.
Yep.
Okay, and of course, by taking good probiotic, you can actually help to preserve your intestinal barrier, and this barrier is actually one of the protective. Because imagine
Yep.
if your intestinal lining has gapped, so they call it as leaky gut. Not sure whether
Leaky gut.
Yeah,
Yeah.
so it's a term. Now people are talking about leaky gut. Leaky gut. What is it? It's actually not clinically, not the diagnosis from the doctor.
Okay.
You can only say that you have leaky gut when your intestinal barrier become more permeable. So it's more like research thing rather than the clinical. But people have shown that if you are not healthy, your gut health are not healthy, they can actually, the bad bacteria is more, so they can actually break the intestinal barrier, causing the leaky gut. So imagine there's a gap, so all the toxin can escape into the circulation.
Understand.
So that is quite interesting. People are
Yep.
actually looking into leaky gut. In
Yeah.
fact, our group, gut research group, are looking into it really deep. Try to understand really people who has leaky gut
Yep.
has the risk to develop multiple diseases.
I
That's
see.
interesting, right?
Yeah, that's very
very-
interesting.
And yeah.
Okay, yeah.
Our gut is so important right now.
It is, yeah. So
Yeah.
so like we heard probiotics a lot, but what
Yeah.
are some of the probiotics products or like food or beverages that people might actually can see in the market, but they don't know that it's actually probiotics?
Okay. So we have culture milk drink. I think it has been many years.
Many
I think
years.
you guys.
Yeah,
Since
since
my
we were kid, yeah.
Since we were kids,
Yeah.
Many years. And this is actually one of the example of culture milk drink. And of course you have yogurt, yeah.
Yep.
And then you have for Malay we have tempeh.
Oh yeah.
Yes,
We
and
forgot
then-
that traditional
Yes,
sour.
and then for Korean, of course, Malaysians are also like Korean. You
Yeah,
have
yeah.
kimchi.
Kimchi,
And of course, yeah. So and then kefir,
Kefir,
and
yeah.
so and so on. So you have that in our daily. You can see it in the mall. That
Understand.
actually is really good. And some of it you can actually consume it. But culture milk drink is easy because they have dose in it.
Yep.
Whereas the rest are, you can just eat, but how much that you have to eat. per
Understand.
day. You understand?
Yep.
Yeah.
So if we talk about like cultured milk drink, basically what are the components of the cultured milk drink?
Right.
Yeah.
So all these culture milk drink, they contain live microorganisms. So that's the reason why they call probiotic. So when you have live microorganisms, so when you consume live microorganism, don't worry because they are considered as good bacteria. Like I said just now, good bacteria, you need good, but you don't want to remove all the bad bacteria because bad bacteria has to be in symbiosis. It's in the balance with the
Understand.
good bacteria. So this bacteria, what they did is when you consume all this culture milk
Yep,
drink,
yep.
you actually helps to, when you eat carbohydrate and all that, it try to ferment all this and produce what is called a short chain fatty acid. And these short chain fatty acids are really good for our cells to work and all that. So that's why sometimes people measure the short chain fatty
Yep.
acid
Yeah.
just to make sure that you have enough short chain fatty acid.
Understand.
Yeah, the good one. Yeah.
Got it. Yep. Shenji.
So basically, short chain fatty acid is also one of the things that produced by probiotics.
Yes.
Basically, the good bacteria, in our
exactly.
in our
Yep.
okay.
Yeah.
So I think that is one of the importance of us
Yep.
having like a good bacteria,
Yeah.
like probiotic in our body, because it helps to produce short chain fatty acid to
Exactly.
see whether our gut is actually healthy or not.
Yep.
Is there any other importance, like on probiotics?
Right. Other than the probiotic, you have to make sure that you take care of your diet,
Okay.
right? So you
Yeah.
guys know better than me. So I think so the beneficial effect of this good bacteria is of course you have to take good diet because you want to take care of your gut,
Yeah.
and then you have to make sure that because once you take care of a good bacteria,
Yep.
you are actually helping in the immune system, yeah, and then of course what we talked about just now, gut-brain axis,
Yeah.
is actually your mental health. And
Yep.
of course, you reduce inflammation, you reduce any of those, and then finally, you actually strengthen your immune system. Therefore, you actually prevent any infections and all that.
Oh.
One of the things to
Yeah.
highlight, I guess, also the good mood that we have been talking
Yeah.
about.
Yeah,
The
the good
mood, we
mood.
are going to feel happier.
Yeah, happier.
Yeah. Shenyi, before you go
Alright.
deeper, I think we've been talking a lot about facts, right? But if we talk about now the practicality part of this, like how much actually that probiotics do we need daily to actually
daily.
achieve that mood?
Good mood.
Yeah, that good mood benefits.
Okay.
Yeah.
So how people always ask questions like how much is too much?
Exactly.
Right?
Yeah.
Right? So you don't want it too much, and you don't want it too little
little.
that
Yep.
hasn't got any health benefit.
Yep.
So in theory or from our study, it's actually 2 bottles a day is just enough. You don't want it to be exceed more than what it needed, but at the same time you make sure that you have to eat properly. You have to
of
have a
course.
good lifestyle and all that.
Yep.
But for just a maintenance dose, 2 bottles of calcium drink like VITAGEN is enough because 1 bottle they contain 10 billion. So you got 2 bottles. That's fine.
That's enough. I see.
That's
Okay,
enough.
but what if we exceed? Is there any consequences to our body if we exceed more than 2 bottles per day, for example?
Okay. All right. So they can actually in clinical, you can
Yeah.
actually take up to 100 billion,
Oh.
which is 10 bottles a day.
Okay.
But who is
Yeah.
taking too much, right?
Yeah.
But for the benefit, because we want to make sure that we don't want to rely on calcium drink, but at the same time, we want to make sure that you are, for Malaysians, you actually take care of our diet, our exercise, your sleep, your hydration, everything. You have to make sure that these are actually consistently, you have to take probiotic just to
Understand.
make sure that your gut is happy.
Yeah, of course.
Right?
Got it.
So,
Got
yeah.
it. Yep, Shenji.
All right. So, and we know that we have a lot of probiotic products out there, right?
A lot.
I mean, cultured milk drinks is one of it. Like, how can we identify
Yeah.
high quality probiotics
Yeah.
product?
If you
Yeah.
just go to the pharmacy, there are
Yeah.
290 probiotic. I don't know how
Yeah,
people everything looks nice
Yeah.
on
Yeah.
the shelf, but you have to know. Okay, first the strain. So like for VITAGEN, they have Lactobacillus acidophilus and Lactobacillus paracasei, and these 2 strains, they have been proven clinically or research that
Right.
they can actually maintain digestive health. That is facts. So that is the strains specificity. You have to look at the strain whether it has been researched before and all that. So make sure
That's
that the
very
strain,
important.
Yeah,
very
that's very
important.
important.
The second thing is that probiotic is not like drugs where they have, how many milligram that you take.
Yeah.
They don't have that.
Yep.
They have what is called a CFU, and CFU stands for colony forming unit. So how much of that? Let's I said 1 bottle of VITAGEN contain 10 billion CFU. What does it mean? It means 10 billion of live microorganism per mil or per milligram, but
Yeah.
in this case per mil of that
Yep.
VITAGEN. So that is actually the CFU count. So look at the pamphlet and look at the CFU strain, CFU, and of course you want to know that it is a live culture or not. It depends. So you have to make sure that this bacteria can survive into our gut. Imagine in our gastric acid,
Yep.
they can actually kill this bacteria.
Yeah.
And how can they survive? So these are certain strains, they can actually escape that and reach the small intestine and large intestine for the benefit of probiotic. So that's the reason why you have to know exactly what it is
Wow.
and the dose and all that. Yeah.
Understand. Yeah.
Yeah.
Right, and I think without your explanation, probably a lot of us will just choose whatever we see.
On the
Probably
market.
some words,
Yeah.
probiotics, then we will just choose.
Yeah.
Okay, that's very
exactly.
useful for our audience.
That's true. Yeah.
Right.
Really confusing. sometimes.
It is,
right?
yeah. I don't even know what is CFU if you don't mention it. No, I'm just kidding. Of course, I learned about it, right? Yeah.
Yeah, but I
Yeah.
believe some of our audience might not know.
Yeah,
right?
exactly.
We need to look for CFU.
Yeah. So
Exactly.
right?
don't trust people when they say that, okay, how much milligram of
Yeah.
probiotic. That's never the
Yeah.
dose of probiotic or live microorganism would be in milligram. They have to be in CFU.
Right. Do mark this thing down.
Yeah.
We need to look at the CFU.
Yeah.
Exactly.
Alright. Just now, Prof mentioned about the VITAGENs is already clinically proven to help with to improve our digestive health, and of course it relates to our mood.
Yeah.
So probably we can move on to the second segment,
Yep.
which
Yep.
we are going to dive deeper into what is basically based on the research study. I believe, Prof Filza, you have been conducted a lot of probiotic study related with probiotics. So what are some of the latest findings so far?
Right. Okay.
Right.
So we have been conducting this study. When we do certain product or any drugs, we have to conduct what is called as randomized control trial.
Right.
So this randomized control trial is actually a properly designed trial. And why is it called randomized? Because even the like for me, the researchers doesn't know the content, and also the participant doesn't know the content.
Is
So
it the
it's
placebo
both-
thing?
Yeah, we have a placebo and we have probiotic,
Okay.
and there is actually no label.
Okay.
So the good thing is that we are not biased, so we just give bottle A, bottle B. That is called randomized, and that is actually, as an evidence in clinical, that is actually the highest. I mean, among the highest most. As you can trust the data. And once we actually design it, we have to register it, and register it has to be in a international website, which is actually validated by our clinical trialists, and every university has got one, and they actually look into it, and also validated by the US counterpart. So everything has to be registered. Once they approve, then you can put the clinical trial number, and once it's that, then only we conduct.
I see.
So and then the latest finding is that we choose participant that has what is called as irritable bowel syndrome. So by the name itself, so these patients actually have abnormal function of their bowel, irritable. So which means that they can have constipation. So they don't go to the toilet for 2 weeks like that, or diarrhea. So they can have the frequently
bowel
constantly
open.
going to the bowel opening and all that,
Yep.
or a mixture of both.
Yeah.
Oh, okay.
That's even worse, right?
Imagine constipate and diarrhea. at the
Diarrhea.
same time.
Wow,
At
and
the
it
same
affects
time.
our brain mood.
Exactly.
Oh my God.
So
Yeah.
what actually happened is that we recruit this based on the criteria.
Yep.
And once we identified them, and then we check with the questionnaire. And what is so surprised about it is that they have what is called a sub-threshold depression, which is a depression, but not a major depression. They have a sub-threshold.
Borderline.
And always be missed by the doctor, because how can you just constipate and diarrhea, and why are you having this? Actually, they are not happy because they don't go to the toilet that often, or they go to the toilet too often that they cannot even stay in the meeting room and all that. So that is second thing. Once we recruit them and we check, to our surprise, 32% of this
32.
yes has sub-threshold depression. So that facts we want to tell every doctor, saying that, look, if you have irritable bowel syndrome patients, you have to check whether they have depression or not. That is considered significant. 32% is quite a lot, right?
1 in 3.
Yes,
Yeah,
1 in 3,
1 in 3.
exactly.
Yeah.
So what we identify them, and then this group, we actually supplement them with the probiotic. In this case, is VITAGEN, and we off-label, as I said, placebo and all that. And we ask them to take 2 bottles a day for 12 weeks.
3 months. Okay.
3 months.
For 3 months.
For 3 months, yeah. So and then we measure pre and post treatment, and then what we found that we asked them to fill up the questionnaire before and after, and we found that it's reduced depression score.
Wow.
That's amazing,
yeah,
right?
impressive,
Something that is
yeah.
not. We don't even expect it to
Yeah.
be like that.
Yep.
And second thing is we take their blood, before and after.
Okay. This is
Serotonin level
interesting.
significantly increased.
Oh.
Really increased. And
Right.
then lastly is, of course, we check the symptom as a doctor. We check the symptom previously. Normally they are irritable bowel syndrome patients. We complain of bloating. They have abdominal pain, abdominal cramp, on that. Reduce all these symptoms. They feel so good that we can actually really happy with the results. Yeah. So that is actually our finding. Amazingly, this is actually being published in a good journal, which is called Scientific Report, which is very peer-reviewed journal, high impact journal.
Yep.
You can actually duplicate and reproduce again. I mean, that kind of work. Very systematic, and we do it, but using our local brand.
Of course.
I mean, using local brand, which is something really we should feel really
Exactly.
proud of.
Yeah,
as
exactly.
well.
Yep.
Okay, all right.
Okay.
That, by listening to what you were sharing just now, Prof, I'm impressed.
Yeah.
I'm impressed saying that, like, okay, so actually based on, for some participant with IBS
Mhm.
Yep.
and with some maybe they are like borderline depression, that helps to improve. Right. Okay. So besides on the mood improvement in terms of the score of like a depression, or also their gut, they feel better, they didn't complain that much on the pain. Is there any other findings from your research that like what is the benefits of probiotics
Taking
or
probiotic,
culture milk
culture
drinks?
drink,
Yeah, culture milk drink.
Okay, so our work, the recent one is on gut-brain axis, but
Yep.
previously we have also worked with VITAGEN on the just a simple one to check their bowel opening.
Right.
So as I said, the IBS patients or irritable bowel syndrome patients has constipation, so they don't go to the toilet that often. So what we did is we check their intestinal transit time. What does it mean? It means the time taken for your food, and then time taken you go to the toilet.
I see.
So we measure that, and it's significantly reduced, which means that normally you take 2 weeks, they reduce 1 week. I mean, that is already you make it happy for these
Yeah,
people,
that's true.
because it's symptom relief for
Yeah.
them. Okay. The second one, because you check constipation, can be really bad constipation, where the patient has to spend more time in the toilet, or that kind of like pressing, and then you not happy,
Yep.
Stress.
Yep.
stress and all that.
Yep.
So that we found that by just questionnaire, it softened the stool, definitely. And the recent one actually, before this, during COVID time, is actually strengthened the immunity by we measure the cytokine that can actually increase inflammation. So what we found that by taking culture milk drink, it reduced the inflammatory cytokine. So this cytokine is actually being produced in our body by all the immune system. So once we take this regularly,
Yep.
it strengthens your immune, you reduce your constipation and all that.
Understand.
It sounds like there's a lot of function on health
Yeah,
benefits.
exactly. Yeah.
Yeah.
I mean, like, if we go back into the question earlier, right, about, does that mean that we are actually drinking bacteria? Right? Yeah. So maybe we want to get back to that question and give
Right.
perspective to the audiences
Yeah.
about it.
Okay. Yes. As I said, probiotic is actually live microorganism. So yes, you are drinking live microorganism, in this case bacteria, but you have to understand that, as I said, we are actually living with bacteria.
Yeah.
So whether you like it or not, we have to be good with them.
Yep.
So in order to be good with them, we have to make sure that we take care of ourselves.
Of course.
And then you have to make sure that everything is in balance, as I said. So you have to take all this good food,
Yep.
Yep.
because when you feed them good food, they will actually give back the good
That's
benefit to
the
us.
thing, yeah.
That you are taking care of them, they will give back the good thing to
Understand.
us, to you. Something like that. That's so simple.
Right. Moving on, probably I would also like to know, are all probiotics alive when we consume them? Yeah, because you mentioned earlier about how can we select like a high quality probiotic product. One of it is live probiotic, right? If let's say we are not taking live bacteria, live microorganism, in this case probiotic, right? Is there any would that be good for our health?
Right, okay.
Yeah.
So cultured milk drink is quite sensitive. As I said, my life microorganisms are very sensitive to heat, to temperature. So what happens is that when you purchase them, so you make sure that you have a very good, like a cold bag with you. So
Right.
if you go to the
Yep.
mall, because what happens is that you just put in your basket,
Yeah.
the shopping basket,
Yeah,
and then and then you push everywhere around, and that will actually cause the temperature to be change, and that actually has an effect to my microorganism. So when I say it's 10 billion CFU per mil of this, which means that it should be 10 billion, but if you not sensitive, not taking care
Yep.
of the temperature and all that, it will reduce the efficiency.
Very
Life
sensitive.
microorganism is still there, but there will be less.
I see.
Right. Okay.
So that's very important for us to check
to
the
check.
storage
Yeah.
instruction.
Exactly.
So that's really important for us to check the storage instruction. It is usually printed on the package, right?
Exactly.
To make sure we are actually taking live
Microorganism.
microorganism. Right. Okay. So just now you did mention as well. I mean, I have a lot of questions. So, Prof, just now you mentioned about like different strands of probiotics. Would there be any extra benefits or benefits if, let's say, we are consuming more than one strain of probiotics?
Okay, so this is back to the clinical evidence, which means the research. So research has found that multi, or in the case of VITAGEN, dual strain is much better than a single strain. So I guess it's in reality, they are actually living, like millions or trillions of them inside us. So they are not alone. So if you take only a single strain, it will not do much benefit
Understand.
compared to a multiple strain. So that is, but you have to know, as I said again, your CFU, the strain, specificity, all those are actually really important for you to check before you choose which probiotic that is benefit for you.
Okay,
All right.
I understand. Yeah, basically we are almost towards the end already. Yeah, it feels sad. It's a very insightful conversation. Okay, let's talk a little bit on the diet side of it. Like how to take care of the good bacteria in our body. If you can have some advice on medical perspective.
Okay. So normally these are the normal advice that if you see the doctor, you have to choose a correct diet. Of course, the high fiber diet is much better, and we have what is called a prebiotic. Prebiotic is actually the food for the probiotic. And then that's a simple definition of prebiotic. And we have a probiotic food, as we mentioned just now, including cultured milk drink. And of course, you have to maintain, or if you don't have any lifestyle, a good lifestyle, which means that you have to exercise, follow the WHO, World Health Organization's recommendation of moderate exercise, 150 minutes a week, and then you have to have an adequate rest. You have to have an adequate sleep. So I'm sure that you guys, young people, you tend to sleep a bit late, but you just make sure that you have enough sleep, and make sure that you drink a lot of water. Hydration has to be good because your body needs that as well. And lastly, you have to make sure that you can tackle your stress. I'm sure with the fast pacing world right now, you are actually, your body also stressed, not only your mental, your body also stressed. So you have to have a very good, support system. So how you want to release your stress. So again, I think that one of the way of releasing it, you have to take probiotic. Make sure that you take enough and consistently, and that will help in that mental.
So we have another option on how to relieve our stress after that. All right. Okay. We are almost the end basically of our discussion today. So but probably the last question, Prof. Can you share with us some of the precautions that we need to be aware of when we are taking probiotics? Since we talk a lot about about it, right?
Yes, yes, yes. Okay. For those who are actually new in this
Yeah.
probiotic and you're not sure, confused on how to choose the probiotic, so you have to choose, as I said, the right strain for the probiotic. So how do you want to check? You can, with the social media
Yep.
and all that, you can
Yep.
actually check whether they are already been done, any clinical evidence on it. Okay, first, and then second, if you are really new and never been taken probiotic, you have to start small to take dose that, as I said, 2 bottle a day, like VITAGEN is just enough for you to as a maintenance, and make sure that you take care of your body as well. And of course, when you are taking calcium drink, especially, make sure that you read the instruction,
Yeah.
how it's being kept,
Yep.
and then you make sure that once you are taking it out from your fridge, you quickly consume it for you to get the best benefit of it. And of course, you avoid certain things, certain medication with probiotic, because you don't want any interaction with the medication. So make sure that you are actually doing it correct way. So especially antibiotic.
Oh wow, really?
Yeah. So
Oh.
so I'm a bit sad on people who are actually some of the people who are actually taking antibiotic frequently. You are actually killing the good bacteria as well, and that is actually sometimes cause you diarrhea and all that. So with that, you try not to take antibiotic except it's being prescribed and very really useful for your condition, and get the specialist to really validate that, and of course the avoid any hot drink together with that, because this is a live microorganism, so it has to be in the optimum temperature.
All right, Shenji.
Yeah.
Yeah, it seems like we have moved towards the end of our conversation, Prof. Is everything all right so far?
Yep. I enjoy it so much.
Do you think you have any other important points that you want to highlight about your research or about this discussion that you think you might miss out?
I think even though you have seen VITAGEN and calcium drink on your sometimes in your fridge, think about it as is something that is actually useful, because it is clinically validated, and we actually have conducted
Yep.
based on the research design and all that.
Yep.
So it has some benefit, definitely has benefit. So people are worried about the content of sugar. I'm sure that VITAGEN has the option of low sugar.
Yep.
So make sure that you take that if you're concerned about your sugar. But as I said, just take care of the gut.
Yep.
Because if you take care of your gut, you are actually... I like to share the Hippocrates saying that all disease begin in the gut, and it's still valid in this modern medicine. So you take care of your gut, you are good.
Yeah.
As simple as that.
Yeah.
But to understand the whole things working
Exactly.
inside our gut,
Yes.
why it takes so long.
Yeah.
We're so happy to see that we finally we are having more and more research that is focusing on this gut-brain axis, and also of course some of the food like calcium milk drinks, for example, what Prof used inside your study, we're using VITAGEN. So I believe, and I do hope we have more and more research that that come out being published, so that more and more our audience or community, they will be educated about this is clinically validated, so that they can actually support their general health.
Yep. On top of that, it's a local research, It's like it's being done here locally, right? So to Malaysian. So the data is definitely representing the people here, the Malaysian as well.
Definitely.
Yep. So yeah, we talk a lot about probiotics, neurotransmitters. How does it affect our mood? How does it improve our mood? Can we actually drink the bacteria, for example? What are the example of other probiotics? And also, of course, the extensive explanation about the research papers and the health benefits and stuff like that. So it has been a very insightful discussion, Prof. Thank you so much for your time. I know you are hectic. You have your own time that you need to manage, but you still try to make time for us. Thank you so much for that. Yep. And I think that's pretty much about it. Again, our episode today is sponsored by VITAGEN. And our speaker today, our guest today, is a medical advisor for VITAGEN, Professor Norfilza. yeah, so don't forget to follow, like, and subscribe, not only Diet Talk, for future episodes.
Yeah.
Is there anything else, Shani, that you want to add?
I think try to incorporate some probiotics in your daily diet.
Yeah, exactly.
Yeah.
That's all from us today. Thank you so
Alright,
much.
thank you.
Bye-bye.
Okay, bye-bye.